In this presentation, we are going to discuss about prescription and its parts. Prescription has been derived from two words, pract, that is before, and scribo or scriber, to write. So, a prescription is an order written by a registered medical practitioner directing the pharmacist to compound and dispense prefabricated pharmaceutical products to the patient under his treatment. Prescription is a combined process between the prescriber and the pharmacist to provide treatment to the patient utilizing the expertise and skill of both the physician and pharmacist. Prescription is written by a registered medical practitioner. He may be a doctor, a dentist, a veterinarian who, after diagnosis of the patient, writes it for the patient. The pharmacist interprets the written prescription and makes medicines available to the patient. Prescription follows a definite pattern in order to facilitate its interpretation, and it is written on a special form called prescription blank. Parts of prescription. The seven major elements of a model prescription are patient information, superscription, inscription, subscription, signature or signa, refill instruction, date, and prescriber's signature. The first part of the prescription is patient information. It contains the name, address, and age of the patient so as to avoid wrong delivery of medication to any other patient. Age and weight of the patient helps in checking the dose of the prescribed drug, especially in the case of pediatric and geriatric patients. The second part of the prescription is the letter RX or the superscription. The RX symbol, which is the abbreviation of the Latin word recip, meaning take dose. Initially, it was believed to be the sign of Jupiter, the god of healing, J being the Jupiter. So, RX, the X part actually comes from the J of Jupiter. Thus, the superscription means take dose or take this and be blessed by the god of healing. Inscription is the third part of prescription. It is the main part or body of the prescription which contains the names and quantities of each ingredient required to compound and dispense products, or the name and quantity of the dosage form. The quantity of ingredients to be compounded in dosage form is expressed in metric system. A physician may ask the pharmacist to dispense an official preparation without giving its formula in detail. Prescriptions for compounding contain drug and non-drug components. When a physician prescribes only the name of an ingredient, active ingredient, and asks to compound a dosage form of a particular strength, the pharmacist has to utilize his knowledge to select proper additives and the vehicle. Since compounded prescriptions does not contain preservatives, it should bear exact dates up to which the product can be used. Subscription is the fourth part. It includes directions to the pharmacist by the physician regarding the dosage form and the number of doses to be compounded and dispensed. The fifth part is signa or signature. The part of the prescription which consists of directions to the patient regarding the dose, route of administration, frequency and time of administration, and the vehicle to be used for administration. If the prescriber writes the word label in the signa, it is the instruction to the pharmacist to mention the name and the strength of the prescribed drug on the label. It helps in rapid identification of the medication in emergency such as overdose. Students should not get confused between this signature and the signature of the physician which comes at the end. This signa is the directions for the patient. The sixth part of prescription is the refill instruction. It consists of the direction to the pharmacist regarding repetition of the prescription for chronic treatment. It avoids misuse of medication by the patient. The directions may be given as repitator 1, 2, 3, 4, 5. As you can see, the number 3 has been bracketed. That means repeat up to a designated number. In this case, it is 3 times. PRN, prore nata, is also written as the refill instruction, which means repeat when occasion arises. If it is written NR, meaning non-repitator, which means do not refill. The prescription with refill instruction should be given back to the patient. The seventh part of the prescription writing is the date and prescriber's signature. The prescription must be dated at the time of writing and also when it is received and filled in the pharmacy. Signature of the prescriber gives authenticity to the prescription. In the case of a prescription for a controlled drug, it must be signed with full name. Occasionally, a pharmacist may like to substitute another brand for the one specified by the physician if they do not have prescribed brand in the stock. In such cases, pharmacists should consult the physician before dispensing. Sometimes the physician writes ARB, meaning any reliable brand, and the pharmacist can ethically dispense a substitute. The generic prescriptions should be prescribed with manufacturer's name. If no manufacturer is specifies, the pharmacist is expected to dispense only a high quality and efficacious brand. This slide shows typical prescriptions. A is a prefabricated product and B is a product to be compounded. In both the prescriptions, you can see the details of the physicians have been given, the phone number, email ID, registration number, the name of the patient, his address, gender, age, and the weight has also been written. And towards the end, the date and physician's signature. If you see the prefabricated product, here it mentions only tablet paracetamol 500 mg 9 times. So the pharmacist has to just dispense a prefabricated product. Whereas in case of B, the product has to be compounded and the details of the product with the ingredients has also been given. Methyl salicylate, hydrous sulfate, white beeswax, and the ointment to be compounded is 25 grams. So the pharmacist has to compound it and dispense it to the patient. This slide shows the types of prescription. First type, central government health scheme prescription or CGHS. These prescriptions are for those who come under the health scheme of the government. These are not charged, but levy charges may be taken. After dispensing the medicines, prescriptions are sent to the account section for pricing. The prescription bears common information and a column for pricing. The second type is a private prescription. Prescriptions are fully charged. These bear the same format as prescriptions shown earlier, except drug of controlled class. These prescriptions are returned to the patient. Third type are the hospital prescription, wherein there are two types, inpatient prescription and outpatient prescription. In case of inpatient prescriptions, these are for the inpatients written on a physician's order form. The patient order forms are prepared in multiple copies for utilization in the pharmacy, in the nursing station, and to attach to the patient medication record. The prescription bears information regarding hospital name, ward number, period of stay, date and time of admission, and discharge of patient. The second type of hospital prescription is outpatient prescriptions. Format of prescription is the same as that of private prescription. These are charged or uncharged prescription as per health schemes. Usually, medicines are supplied in quantity sufficient up till the next appointment. Record of prescriptions should be included in the patient's medication record. The summary of prescription and its parts. Thus, prescription is an order written by registered medical practitioner directing the pharmacist to compound and or dispense a pharmaceutical product to a patient. The parts of the prescription are first, patient name or patient information, which has the name, address, age, weight. Superscription is the symbol RX. Inscription is the formula or dosage form. Subscription is directions to pharmacist. Sign is or signa is the direction to patient. Refill instruction Is repetitor PRN or NR? And lastly, the date and sign of prescriber.